Okay, thank you for the opportunity. I have to say to Professor Cho, Chulsuk, Ryan, Sergey, and guys from DYNE, giving me this opportunity to share with everybody my experience with the 6 o'clock working channel. So I think Dr. Fernando has introduced me. I'm the alcohol and wine guy. So hopefully everybody's with me in this few slides of mine. So I work in Universitas Indonesia Hospital. It's near Jakarta. It's a bit out the outskirts of Jakarta. Okay, so as we all know, we have a lot of different scopes that are available, but mostly, as I bet most of us here already experience, it's either on the left or on the right. It's either 9 o'clock or 3 o'clock. It's always like that. So there's a wide range of variety, weight, and also deflection capability, and etc. But all of these scopes have their limitations in that you have to use certain scopes for certain location of stone, etc. So with this, I think the next step would be how to make a universal scope, an application, so that we can use it like anywhere. I actually, Dr. Beckes had already mentioned this before, but to add to his previous talk about this, as you can see within the literature from Dr. Olivier Traxler, you can see that there's recommendation as well. So, for example, the left anterior calyx, it's better for the 3 o'clock position, and etc. So there's a few recommendation in this publication as well. In choosing scopes based on the location of the stone. And then more or less everybody knows about this, the image intraoperatively, if you use either the 3 or 9 o'clock position. And of course, with this position, it influences the irrigation flow. The movement of the stone might be different as well. So after you lace, and there's smaller fragments and dust, there's going to be a lot of movements around. It depends on the irrigation location and the working channel. The dust might behave differently, and also dictates obviously our working channel, whether it's laser, basket, etc. So we have this publication before talking about learning curves. So as we all know, usually besides flexibles, we always use anything else on the 6 o'clock. If you do PCNL, if you do semi-rigids, if you do instruments on the lower track, it's always on the 6 o'clock. So in this publication, actually they divide 80 cases into 4 groups. They have a third year or final year resident do the cases. These residents has experience of over 250 semi-rigids. So they want to see how do they perform if they were given a flexible scope. So with different channel, obviously. It's the 3 o'clock channel. So all the stones are below 15 millimeters, and if you can see, the learning curves plateau at 60 cases. So although these residents have already done more than 250 cases, they still need, additional cases for them to be able to handle better with a flexible scope. So, and also this is also a Professor Cho's research as well, seeing the fragmentation efficacy with flexible RARS, and we found that the plateau begins after 56 cases, so it's more or less the same. So you need additional time, additional cases to be able to handle the flexibles better. So this is one of my case I did in Jakarta using the 3 o'clock position. As you know, we always, as Dr. Beckes also have it in his slides, we always have a difficulty in reaching some of the calyxes, especially if the mucosa is in the way. So because we're working the lasers on the 3 o'clock, then mostly probably like 2/3 or more than half of your vision would be the mucosa. So it's very difficult for you to reach the left side of the stone. Professor Cho always teach us that before you do RRS, make sure you're able to access the left side and the right side most of the stone. So as you can see, I'm having difficulty. Of course, this is before my fellowship here, so I'm not too good probably in doing the RRS, but still, it's very difficult for me to access the leftmost part of the stone. So this is, I had the privilege to be the first one in Indonesia to test the 6 o'clock urus DYNE. Thank you for the support. We did 7 cases in 3 days. And then the last day I gave one of my residents to try it as well. As you can see, the rightmost part is my resident handling the scope. This is his 4th time ever holding a flexible URS. So, but his first time using the 6 o'clock, but his 4th time overall doing RRS. So if you can see the way he's handling, because it's similar to a semi-rigid or a nephroscope, it's very easy for him to getting used to it, to adapt to it. And also with access sheath as well, because usually what you have, if you're using suction, of course, if you have the scope, the laser at 3 or 9 o'clock, you can't actually able to measure the distance between the tip of the laser to the outmost part of the access sheath, right? So sometimes you get damage in the access sheath. With this, I wanted to lace the stone whilst providing suction as well. So with this, I found it's very easy because you can measure the distance between the tip of the laser fiber and the lower part of the access sheath. So this is, I would say, an additional advantage of having a 6 o'clock channel. So in conclusion, probably 6 o'clock. Of course, it's more studies are required because since this is already a new armamentarium, but 6 o'clock, in my experience, provides a more natural orientation since it's the same working channel we used to do in other instruments. And also evaluation of the entire stone while lasing is very possible. You can definitely reach the left side, leftmost and rightmost part of the stone. Possibly learning curve are quicker. Of course, it needed more research about this and can be minimum damage to the access sheath. Of course, all in all, again, we need further data about this. But I'm sure it's a promising next step for us to do flexible RRS. With that, I invite all of you to Bali for the UAA meeting. It's going to be held in September 5th to 8th. Please come by and say hi. Thank you for the opportunity. Fernando, I'll give it back to you. Thank you.